Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Ahmed Fool. I am the head of geriatrics unit in Rashid Hospital, Department of Health, Dubai Health Authority. Today I'm going to speak about a very sensitive topic and very critical topic at the same time, which is end of life decision. One day all of us will die. We are not immortal bodies. We live to die. But how people die? What's meant by end of life? End of life means when one of your vital organs reaches to the stage that there is no reserve. The kidneys has stopped working, the brain, multiple strokes, many strokes, very advanced dementia, that you are bedridden, not aware about who is talking to you. You cannot speak, you cannot understand, you are only breathing body. You reach to a stage when your heart fail. If I'm speaking about organ by organ, because all these illnesses does not happen in one person, but each person has to choose the way he will die. Heart failure, the ejection fraction, by which we measure the capability of the heart to contract, normally it's 60%, 65%. When you get heart disease, recurrent heart attacks, your ejection fraction by time decreases gradually. So it reaches from 60 to 55, 50, 45, 40, 35, 30, 25, 20. Now you are at a very critical stage. If another attack happens, you will die. Or if any severe infection happens, probably your heart will stop. So this is what I mean by end of life, when there is no cure. Cure means there is no treatment to bring you back as if you were born, to remove this failure from your system. There is no treatment for that. All the treatment we are doing is to ameliorate your condition, to try to bring you without symptoms, to make you without symptoms. But there is no treatment to tell the disease, go and don't come back. It's not like malaria, I'm treating malaria, there is no malaria. No. Chronic illnesses, you're still having your illness, and the illness is going and deteriorating by time till a stage when all the reserve have been finished. This is what we call end of life. Now, I'm going to speak about the decision at that time. What's your decision? You reach to the hospital in a very bad shape, like every time you go to the hospital with heart failure or stroke or acute exacerbation of renal failure or acute exacerbation of liver failure, then you need to go to the hospital like every time. But this time is different. The doctor realizes that this is the end. Probably you will not come out of this time. I want to tell you the truth. Nobody 100% sure that you are going to die, but you are in a very bad shape and the probability of death is very high. Now, if your heart stops, do you know what's going to happen to you? I will tell you what's going to happen to you in the hospital. We are going to put a tube in your throat in order to connect you to respirator or ventilator. One very clever physician will jump beside you on the bed, giving you thrusts to your chest to make your heart beat again. And you are now in your age of 80s, 85, 90, probably more or less. Your ribs become very thin and your muscles become very weak. And one push from him, you will listen to the cracks of your ribs fracturing. It's very painful, but probably at that time you are not conscious enough to feel that pain, but you will feel this pain later on. And the other person in the above your head putting the tube, can you imagine, put your finger in your throat and see if you can tolerate it or not. Somebody will put a tube in your throat to connect you to the respirator. Somebody else is trying to find a vein, because during shock, no veins will appear easily in your arm or in your legs. So he will try multiple times, probably 10 times or more, putting needles inside your body. Somebody is putting urinary catheter inside you. They are humiliating you. And what is the end result? The end result is you will go to the ICU. You will stay in a place, people around you, you don't know anybody of them. The sound of the machines around you are very troubling and very irritating. You cannot sleep at night. There is no night, there is no day, because the 24 hours are similar activity. You are suffering. Who told you to do this for me? I don't like to be here. Let me die. Because you know why you are here? I will tell you why you are here. Because you did not decide for yourself before coming to this place at the end, at the last moment. You did not inform your son. You did not inform your sister. You did not inform your daughter that if my heart stops, please don't wake me up. Because you know now what's going to happen to you. But the doctor has his excuse. He has no information about your wishes, what you want. And also, their close relative, they believe that if they try hard to keep you alive, they are doing a favor for you. They don't know that they are inflicting very bad harm to you. What is the other way? This is one way. What is the other way? The other way is one clever doctor come telling your daughter or your son, your dad is dying. He will die. Doctor, are you God? You are telling me my dad is going to die? I am not God. But your dad will die in few hours, few days, few weeks. He is going to die. This is the end for him. I know from the investigations that his heart is like that. His kidney is not secreting. These are the characteristics of people who are going to die within days. I advise you, take your dad home. Let him spend the last hours, last days among his children, among his grandchildren, and we will reach your home with a nurse who can offer all the treatment available in the hospital to your father. We'll give him antibiotic, we'll give him diuretics to make his lung dry, we will give him analgesics, we can give him up to morphine at home to reduce his anxiety, to reduce his breathlessness, and keep him comfortable and communicating with you, telling you the last words he wants to tell you. He wants to listen you telling him, forgive me. He wants to listen, I love you, Dad. He wants to see his grandchildren around him. But what you want to choose for your dad, this way or that way? I'm telling you, don't choose for your dad. Let your dad choose for himself. Now we are choosing for our dads. But who will choose for you tomorrow? You need to choose for yourself. In Europe, in America, they are giving a questionnaire to you. We call power of attorney. That you decide for yourself, when my heart stops beating and I am terminal, not any stop beating. Let me clarify this point. Why this old technology? Why these old ventilators and respirators? Why we created these tubes and needles? It's not for terminal patients. It is for young people. Somebody who took drug overdose and he is young, 20 years old, 30 years, and his heart stopped. We will do everything for him. We will do massage for him, but his ribs will not going to fracture, because his bones are strong. And if a patient drown in the sea, and his heart stops and his lung filled with water, bring him to the hospital. He's 20 years old, 30 years old. We will do everything for him. We'll take him to the ICU, because after 2-3 days, 1 week, 10 days, he will be walking normally on bed, working, married, get children, live normal life. These equipments, this technology are for people with hope for continuation of a normal life. But for patients who are terminal, who are going to die, I am inflicting harm upon them. Technology is not always the best for all people. There is no religion on earth says that you have to prolong the life of a person who is impending death, because no religion on earth they inflict harm to people, induce pain to people, prevent them from staying with their loved people the last hours, days of their life. There is no religion say that. So we need to judge correctly before saying we are not going to use these machines for these people. I'm not including all the people. I'm including only certain category of patients who are terminal. And God told the Prophet Muhammad in Quran that you are dead and they are also dead. Prophet Muhammad died, all prophets died, the most eminent, the supreme people on earth has been died. All of us will die. But we need to die with dignity, without dying in pain. This is the message that I need everybody in the community, especially in our Arab community, to know. And thank you so much. And if you need more information about illnesses and old people, please visit forgetmenot.org. Thank you.